I'm being brushed off. Let's change that.
Today we are going to talk about stop being brushed off by your doctor or any medical expert for that matter, and several ways to have your doctor take you seriously.
Yeah.
you look, you're looking forward to this. That's good. So, shall we hit off straight away with why I came up with this?
Yeah, yes. Sorry.
Okay. So, some of you may notice, some of you may not notice, but just recently I had a different physical therapist, and I talked to him, and he, well, it came down to that I didn't feel like he took me seriously, and it brought me down, back down memory lane. Like the first time I came and visited the first doctor, like, okay, I have a problem with my ankle. I know there's a bone loose, um, but can you please do something about it? And he was
Hmm.
like, yeah, okay. And, he basically didn't want to do much about it. Let me walk around, no cast, no nothing. Literally, no crutches even. He just let me continue on. And that took about like 3 or 4 months. And they even, another doctor gave me like exercises. And it wasn't until I finally hit a brick wall, as in I couldn't walk on anymore, and I ended up at the ER with crutches. And then I got hurt. They did this MRI, and then still, when I said, yeah, but it was like, no, we are going to do this, that, and the other, and even that took him like 9 months. Well, I don't know, 4 to 5 months before he agreed to saying, okay, we're going to do more than just put you in cast, because
Yeah.
he just didn't want to do the operation. He just didn't want to do it. And then when I said, but if you're going, because by that time I knew I had the torn ligament, which I didn't know at the beginning, but by the time I knew, I said, okay, are you going to do something about that little bone? And he said, no, we're not. So he did an excellent job when it came to stitching the ligament, but it just wasn't
Yeah.
enough. So, and then I went on and on and on from doctor to physical therapist to the next one and so on until I finally um, found someone who was willing to listen. So she understood where I was coming from, um,
Hmm.
and well, what I want to talk to you about is what my journey basically taught me and what I've done differently just recently, as in last year,
Hmm.
when my knee caved in, and how that basically worked. So, hmm, sort of my story.
Yeah.
Yeah.
Uh,
Yeah, you've heard it like a million times by now. So,
oh, that's fine. Like I'm. It's interesting because our stories are so different. Because I've honestly never had a problem with a doctor.
hmm
I mean, I haven't seen a orthopedic doctor in many many years. I've been lucky like that. But all the doctors I've seen listened to me, knew what I needed, knew what was going on, and I've had many surgeries, but I haven't had one since I'm 17, so that was almost 30 years ago.
hmm
I've been lucky. It's just it's hard that you. I'm sorry you had to go through that.
So, do you think that's the difference between the US and Europe
It's
or the Netherlands?
possible. I mean, I haven't spent enough time in a different country to notice or know if that's the case. I've only ever been to Ireland when I was 19, so that was 97. So it's possible, and it could be either the doctor himself, or the country, or just the how things are run.
Yeah, that could be true. And I know that they're trying to So we have like the improved version of, I don't know if you want to, like Medicare, Obamacare.
Hmm.
We are obligated um, to pay a certain amount of money, and then everybody gets a basic um, version of care, which is
Yeah.
actually which includes all the surgeries and all that stuff. The only thing is that sometimes they prescribe different brands because they are cheaper, and they might have um, uh, contracts with certain hospitals which are cheaper.
Hmm.
So that's where it's basically where the variations are. But everyone is entitled to get medication, to get surgery if needed. It's just how much time do they take for you? How much time
Yeah.
do they take out? So,
Yeah.
well,
Because that can take a while. What were you saying?
well, we could go and just go past those criteria and see where the differences are, and then I'll just, I'll go along with my story, and we'll see.
Okay.
So, the first one I've come to list is for me the most important one nowadays. I When I go to see a doctor,
Hmm.
um, but also to a degree a a physical therapist, I need the person to understand me, and whether it's because they've experienced it themselves or they know people close, it really doesn't matter. But when it came to my knee, for instance, I've been to two doctors, two
Hmm.
surgeons, and one didn't have any experience with it, and the other one did, and that's why I also picked him, because for other reasons too.
Yeah.
And he immediately, I felt hurt, like in the first second. And the same applied to my physical therapist. His son actually has problems with his ankle, so that's how I ended up going there again, because I knew him because of my niece actually.
Yeah.
So I've known him for a long time, and
Okay.
but he understood where my problems came from and how it made me feel.
Yeah. Because it can make you feel defeated. Yeah. And
No, no,
yeah.
no, not just defeated. Literally, how it felt like, was the pain, what I could do when it came to stability. So
Mm.
was optional for me and what wasn't optional for me. So when I would have trouble playing drums, for instance, he would understand it, because he would recognize the movement I would make,
Yeah.
and then
Okay.
he would combine it with, oh yeah, I know why you cannot do it.
Yeah. I get that. Yeah. Because
So from all the surgeries you've had, do you think
yeah.
all of them understood you?
Do I think what?
That all the medical experts out there, all the doctors, basically understood you, or it wasn't
Yeah.
necessary?
I, I felt pretty understood. I mean, every surgery I got, I needed, and most of them helped me. There was one when I was 8 years old. I got double hip surgery, and they actually flew me from New York to Boston because they had a children's hospital there, and I got double hip surgery. That one worked for about 2 weeks and then stopped. Other than that, they've pretty much been spot on.
Okay, well, that's good. That's good. Sorry for that.
It's fine.
Um, okay, so we can agree that if they make you feel heard, understood, safe, maybe explain it to you,
Hmm.
that usually works.
Yeah, yeah, yeah.
Yeah,
Yeah. As long as like you're on the same page, that's important.
yeah, I love that, being on the same page. I totally agree.
Yeah,
Okay, so the
that
second
goes along
one,
with speaking
yes.
up, and that goes along with speaking up, so everyone knows where everyone is.
Yeah, that's true. And it's about being fully understood. And
Yeah.
if you have questions that you can ask them, and it's literally not being brushed off, like
Hmm.
you stupid, they
Yeah.
won't say it, but they can make you feel really small. Or,
Yeah.
yeah, I'm sorry, I don't have any more time. I need to go. Okay, can we schedule it? Bye.
A lot of doctors are like that though, because they have a lot of patients.
Yeah, yeah, and that's maybe the thing that um, if they don't have the time,
Hmm.
it's less likely that
Yeah.
you might feel hurt.
Yeah. I
And
think spread a little too thin sometimes.
and one of the things I came to understand, and I don't know about this, is I don't know if they tend to think that people like to exaggerate and they downplay it, or
Hmm.
that it's like, okay, if you really have a problem, you don't get discouraged, but you will keep coming back.
Hmm. Yeah. Okay.
So, any of that seem familiar, or again, no,
Well,
doesn't.
if if you're left with a feeling of just being okay, or just being like lukewarm with the doctor, you're more likely to just keep going rather than just being really mad and upset and not heard or seen at all. So if you're in the middle on the spectrum as far as like being okay or being mad, you're more likely, I think, to just keep with it and stick with it and see where it goes.
Yeah, I agree, and especially the letter. Um, if there is a next appointment, then that's something you can work with because there's more to it.
Yeah.
Um, but, but here's the thing. When are they going to do certain tests, and what do you need to do in order to get them to do those tests?
Well, you need to like suggest it, see what they say, just have a give and take and a back and forth, and just be heard. And if they don't agree with you, then and if they don't agree with you, and you feel strongly enough to have that conversation and know you need that, then that's when you need to go.
Yeah, that's true. And one of the things I suddenly realized is I've been brought up, as in tough. So when I actually say when they ask me how I'm doing, I say, well, I'm relatively good because it's manageable. That that can go two ways, and I've learned to say that doesn't mean that there's no pain. That means that I know what to do about it, but it's still not good.
Yeah,
Whereas the other one would actually go in like, oh, that means that all is okay. I don't have to do anything anymore.
yeah, that's true.
So
They don't. They just feel like there's less responsibility sometimes. If they do a little, then they'll assume that you think they did a lot sometimes, and that will like make them have less responsibility if they don't get pushed.
yes, Terry is going to come in. Don't be
Okay.
surprised.
Okay. Hi,
Hey, there's Terry.
Jerry.
Hello.
How's it going, man?
Good. How you doing?
I'm doing absolutely fantastic. Two beautiful people right here. And
Oh,
I wouldn't be remiss. So Lexi was asking me over on Evan's channel if I was going to join in tonight. And I was like, man, I got some things I'm working on. But you know what? I cannot like not come over here and say,
oh.
how's it going?
Yeah.
Well, two
Good.
amazing guys. What more do I want?
Yeah.
You're, you probably know this because you might have read a little thing on Evan's channel, but I'm talking about stop being brushed off
Mm-hmm.
by the doctor. So we are
Mm-hmm.
trying to figure out if there's a cultural difference actually
Mm-hmm.
between the Netherlands and the US.
Yeah.
And I've got like 7 criteria, 7 ways to 7 things to take into consideration. And the
Mhm.
first one had to do with being understood, whether it's because they've experienced it themselves or
Mhm.
and it's nice because Mike already said it's like when you feel like you're on the same page, that makes all the difference. So have
Yeah.
you ever encountered like that you felt like you were being brushed off, not taken seriously?
So I have a couple of different stories for you. So story number one is years ago. I can't remember the exact year. I remember the situation. I went into the doctor and I wasn't feeling good. I was coughing a lot. I was, I literally felt like I had pneumonia. And it was one of those things to where I went in and I was trying to get, I went through all the vitals. I was like, they checked my vital signs and everything. And I went in, I sat down to the doctor, and the doctor basically, was just like, explain what's going on with you and this, that, and the other. And I was like, this, and this. And he was like, okay, what do you want? I was a little confused by that. I was like, what do you mean? What do I want? He goes, is there a problem? I'm like, no. What do you mean by that? I was like getting more confused as the situation was going on here. And the guy was like, do I got to close my door? Do we need to go somewhere else for this? I was really getting confused by that because I was like, man, does this guy want to fight? Is he going to help me? What's going on here?
Kind of weird.
So I was weirded out. I was like freaking out at the moment. And it just got to the point to where ultimately the guy was trying to figure out what I want. So apparently this doctor was so used to like people telling him what they wanted, and he just provided them exactly what they wanted, to where he was kind of confused and taken back because I was one of the few people that went in there and didn't demand, this is what I want. This is what I want. I want you to do this. I want you to do that. I want you to give me this medication. And there are doctors that are out there that will literally just let the patient tell them what to do, how to do it. This is what I want. I need these drugs. I need this, that, I need this, type of, thing. And the doctors just don't doctor at that point. They just take demands from their patients and they fulfill those demands because they don't want to be sued. They don't want a lawsuit. They don't want all these and all that. So there's one story for you. The other stories that I have been truly phenomenal. I go into the doctor's office. I tell them everything that's wrong with me. They have full support. They have, they check me out. They have recommendations. They say, do this, do that, take care of yourself, do this. I want you to come back and have a checkup. So I've experienced a few different things when it comes to doctors, but here's the thing that I've discovered over the years. Over the years, I truly believe that doctors have allowed patients to really just kind of like tell them what they want and how they feel and what they need. At the opposite end of that spectrum, there's some really great doctors out there that, are truly practicing good doctorship, if I can use that as a word, kind of a thing. But and it's hit or miss. I mean, I've seen some doctors that follow a flow chart, and it's one of those things like, if this, then that. And it's like, dude, don't follow a freaking flow chart with me. Like, you're guessworking here. It's like, if I tell you this, then that. And it's like, well, you have this. I was like, are you sure? Are you positive that's what I have? Or are you, so once you challenge them, it's like, well, that's what the chart says. Well, what do you say? What is like, you didn't even poke me, prod me, freaking take blood. You didn't do none of this stuff. You're just guessing. So I have mixed emotions and mixed feelings about doctors. And I truly believe that we've lost the art of quality patient care.
Yeah, listening, taking time.
Yeah.
Because
I go to the doctor. I go to the doctor quite often because of my disabilities. And I remember one doctor, he was just I've had a couple doctors that are just very abrasive. They're just so used to patients talking back at them so much, like they've become abrasive themselves. And I'm like, dude, I need you to calm down, bro. Like, it's going to be okay. I'm your patient. We're good. I'm paying you. Just help me out. Listen, hear me out here a little bit, kind of a thing. Because I have had one doctor that was just really abrasive. He was just like, do this and do that. I mean, I grew up in the military. I'm used to taking orders and people telling me what to do. But, man, this dude was abrasive.
Doctors shouldn't be like that.
Yeah. So... That's kind of my little story and take on some of my experiences, anyway.
Okay, well, it's two very, very extremes.
Uh-huh.
And when listening to you, I guess, I do have some suggestions, possibly, because I know this is not right and that's not right, but it's
Hmm.
not like I demand them to do something. It's like, this is my problem, do something about it.
Hmm.
And I might come up with a suggestion, but the funny thing is that in both cases, the two doctors I've ended up with, both for my ankle and my knees, actually suggested something totally different. But because they knew what I was talking about, and they took the time out to explain it to me, that made all the difference.
Hmm.
And then I said, okay, yeah. So, like, for instance, which was my knee, the first one I went to, he said, like, you need surgery, but I'm only going to do half the surgery you want. And I was like, yeah, well, that doesn't feel good because if you take part of the meniscus, no, doesn't feel good. I don't think you should because that's going to, in the end, um, end up me getting an artificial knee much quicker than I want to. And then when I went to the second one, which I had selected based on a number of criteria, one of them being that he actually had a torn ligament as well.
Hmm.
He explained to me why it was better to hold on to the one I already had. And he indeed said, like, you are right. If you are going to get that other surgery, you will need an artificial knee like in 2 or 3 years. So we are going to do something different if you're okay with that. Of course, I was okay with that. The moment that he spoke to me like that, I was like, sure, do
Yeah.
anything you want.
I wouldn't know why you would want to do half a surgery anyway. That's
Well,
not.
I basically had multiple problems, and that's what the
Hmm.
same thing which happened with my ankle. I had multiple problems with my knee was the same thing. So I had a torn ACL, and normally they get replaced, but if you're too old, they don't replace it.
Hmm.
Okay.
And so I didn't go along with them saying it's strong enough, so you don't want it done, or your own material is strong enough, especially knowing that I've got the EDS. But when they said that every surgery, even replacing the ACL, would have an effect of the quality, diminishing the quality of the meniscus. I'm not sure what the English word is. But for me, and for the people who don't know it all, it's like the cushion where your upper part of your leg rests upon, so it's on the top of your lower leg.
Cartilage.
Um, so, and that cushion, that's basically torn down. It's diminished on the inside of both my knees. So when he said, "Yeah, we don't want that to go any further," I was like, "Yeah, we don't want that," you
Yeah.
know.
Yeah, you're losing. You're like Michael said, you're losing cartilage.
Yes,
Hmm.
that's the exact thing. I'm short of cartilage on the
Hmm.
inside of my knees. So and I literally mean on the not on the outside of the legs, but the inside of the legs. So
Hmm.
we called on the medial side. Oh my. Yeah, I'm going to say this in English. Yeah, this is a good one. Well, never mind. Um, but the cartilage, yeah,
Hmm.
it's diminished. That's
Yeah.
totally true. And that he showed me actually on the picture. That's what
Hmm.
he did. And he said, "See, it's only like 4 millimeters here, where it's like twice as much on the other side." And I was
Yeah.
like, "Oh yeah, that makes sense."
Yeah.
And that's maybe it, them explaining it.
Yeah, yeah. I've had hip surgery once, and it's one of those things to where I was like all up. I was all in it. I was like, I want to see. I want to be awake. I want to see the doctor cut me open, and I want you to show me that thing. And and that's just me. That's just kind of how I am. So I remember when I had hip surgery, doctor removed a mass that it was non-cancerous. It's actually growing back. So I had that thing removed quite a few years ago, and it's actually growing back. So I need to have hip surgery again, and it's an injury that I had 30 years ago. So an injury that I had 30 years ago that has actually grown back a couple of times during the course of 30 years. and it just may continue to do that. I have no idea. So it's one of those things to where it can be frustrating when you have to go in for multiple procedures. But to Michael's question, sometimes you have to have one procedure to build up the strength to go back in and have another procedure. So it's one of those things to where it's like a lead into what is next. And I've had a couple of things like that over the years. I would have to say that the worst surgery that I ever had, I mean, that hip surgery was kind of neat for what it was. I had my tonsils removed. I want to say, I mean, other than like wisdom teeth, tonsils removed, I haven't had like any major. I mean, I've had one major surgery, but I'm not going to disclose that one. It's a guy surgery. I'm sure you can read between those lines. But it's one of those things that when I had my tonsils removed, it was a necessity because I had tonsillitis, I had strep throat, I had pneumonia all at the same time. And I used to get sick every year. So every year when I was growing up as a teenager, it was one of those things to where I would always get sick. I'm like, what is causing this freaking sickness, man? Every year I would just get like majorly sick every year. Well, one year, and it was my senior year in high school, this was back in 1989, 88, 89, and it was my senior year in high school. I was bedridden for like 6 months. I was in a bed. I couldn't do nothing, couldn't move, had no energy, throat hurt, head swollen. So I had pneumonia, strep throat, tonsillitis all at the same time. Went to the doctor, got my tonsils removed. Guess what? I haven't really been sick since then. Every once in a while I will get sick, but it's one of those things to where that was actually the worst time that I had ever had like some type of a surgery, but it worked out in the positive because once I had the surgery, it worked out for me.
Yeah, and that's of course what you want.
My wife tells me I have the immune system of the gods because I never get.
Mm-hmm. Well, I try to take care of myself. I mean, there's a lot of protective measures, a lot of different things, especially nowadays because, and this goes into really what Lexi was trying to allude at, and that's having options. And when you have options, you can really take better care of yourself, or you can get different opinions. And I think that when you go to doctors nowadays, and if you do not get a recommendation that you fully agree with, get a second opinion, get a third opinion for that matter. That way you have options.
Yeah. Don't go to the one who's the most nearby. So Joe actually said she had hers taken out too, and she never got ill anymore. And I like the example of the tonsils taken out because, nowadays they do it more often at a younger age, but because they didn't know what the effect would be long term, they were a little bit hesitant about it. But
here's a fun fact. So this is something that I don't really share very much with people, but it's a fun fact. I have no feeling in my face. Like a lot of times you'll see me like talking and like my lip will look kind of interesting. So see, now I got Lexi paying attention to me now. But I'm being serious because she always wants to look at my eyebrows because I told her about my eyebrows. But anyway, no, I'm being serious. My bottom lip, I have no feeling. My teeth, I have no feeling. My jawline right there, I have no feeling. I got my wisdom teeth taken out 22 years ago. So 22 years ago, I got my wisdom teeth pulled out. And right here on this side, the doctor severed the nerve in half, and it took away all the feeling right here on this side of my face. So it took me about 2 years to relearn how to kiss my wife. It took me about 2 years to learn how to like eat stuff without it dropping out of my mouth. Because even to this day, 22 years later, my lips numb, my teeth numb, my jawline, my chin, it's numb. I can't feel it.
That's not that.
I don't feel that. That would piss me off.
It's frustrating because every now and again I'll get this tingly sensation. It's like like your leg falls asleep or your arm falls asleep or something like that, and then it's trying to come back. It's like a really bad tingling sensation, and then it gets to the point to where it hurts and it actually itches. So I'm sitting here doing this crap to my lip, trying to scratch my lip because the nerve that's in there, it's like doing something. So I got to scratch my face.
Yeah, it grows. It grows back. So it tries to connect. And there is this disconnect. So it's like a short circuit, and that's what you're experiencing. Yeah, I had my wisdom teeth taken out too. And then, so I asked beforehand, how long is this going to take? Because I was a trainer. I said, can I speak again pretty soon? He said, sure, you can. 1 day of sick leave, that's it. Well, wrong. I had such a bruise on my face, and I literally held on to the bench, to the table, because I was like, man, they're pulling, because it broke down, and they started pulling again. So then I came for round number 2, and they said, not to say anything, but last time I had such a bruise on my face, it took me 2 weeks before I could actually speak again and swallow again. So I had this on the picture. So I said, would you mind being a little bit more careful? And he was like, really? Has this happened? I said, yeah. And that's me.
I had 3 wisdom teeth pulled out like a couple years ago.
Yeah, all 4 of mine have been taken out, but 2 at a time.
Oh, wow.
Yeah. Yeah, I've had kidney stones before. That's no fun. But I would say that the worst thing that I experienced, I was actually bedridden for 2 weeks, and it was kind of a freak accident. Well, it wasn't an accident. It was just I rolled around in some fertilizer that was on the grass. So when I was in the military, we used to do these things called grass drills, and basically it's exercising in the grass. Well, we're rolling around, we're flipping, we're just in the grass, like you're just becoming one with the grass, right? So that's exactly what we did. We went out and we did some exercises. Well, little did I know, they had literally just put fertilizer all over this field that we was on. So I'm over here rolling around in all this fertilizer, getting it everywhere. Anyway, that day, I just started like getting a rash everywhere. And I broke out and I was in pain. Next thing you know, I'm on the couch in the fetal position, and I just am in just pain. I can't move. I feel like, everything's shutting down on me. So for 2 weeks, that's exactly what I did. I stayed home. I was in the fetal position on the couch, couldn't eat, couldn't sleep, just was in pain, had a rash everywhere. And it was because I rolled around in a bunch of fertilizer, and I found out that I had an allergic reaction to it.
Oh, wow.
Yeah. Oh, that sucks. Yeah. So Joe says that her worst experience was having 5 broken ribs and a fractured eye socket. Yeah, I imagine that would hurt too.
Yeah.
Try falling off the top of a roof of a building in Iraq. I did that.
My worst pain was my gallbladder. That was like really. I would have attacks where it felt like a 200-pound man was staying on my stomach all day. It was bad.
Yeah. Wow. I wouldn't say that I actually experienced crucifying pain. It's like whenever I would do something which wasn't right, I would try to find a way around it. So for me, pain has always been manageable. But then again, I didn't fall off a rooftop. And Michael, what was it again? What you said?
Yeah, gallbladder.
The gallbladder. Yeah, that seems to be very painful.
For years, I had a gallbladder problem, and they said it was an ulcer, and then I was I went to the ER, and they said my gallbladder was diseased, and I had to have emergency surgery the next day.
Yeah.
Hey, and that brings up kind of a valid question. So, Michael, this is a question for you. Sitting in a wheelchair, you ever experienced sciatica nerve damage?
No, because my legs never hurt. If I stand up for more than 2 hours, my back will hurt, but my legs.
That's interesting because I stand up all the time, and I absolutely 100% do not like to sit down. It's one of those things that I sat down so much for so many years. It's one of those things that I developed hip pain and sciatica nerve damage on my lower side. So even when I'm standing now, I'm starting to notice, as I get older, I'm starting to notice like little differences where like, okay, my hip hurts, my leg hurts. And it depends on which way I lean. So that was kind of the one thing. So if you favor a certain side, if you're sitting down, do you notice any difference whether you favor a certain side or not? Or do you notice that? Okay.
But I never have pain in my legs. It's always in my bottom, but the bottom of my back is what it is.
How about your arm holding on? So like if you lean to your right and you like hold with your right arm? Do you ever notice like elbow pain or arm pain or shoulder pain?
No, the only pain I ever have in my arms is when I work out too much or like have too much weight,
Yeah, I
or,
got it.
or I
Yeah,
elbow or something.
I experience a lot of elbow and shoulder pain, so I try not to lean on anything. And I'm at a point now to where it's like I don't even want my arms or elbows to touch anything. The nerve damage is so bad within my elbows and my arms and my shoulders that if I touch anything, it's going to hurt. So I'll sit there and just kind of let everything kind of free hang, so to speak. Even if I'm sitting down in a
I know what
chair.
you're talking about, Terry.
Yeah.
I know.
My shoulder will twinge if I pick up my chair because I pick up my chair to put it in my car, and then doing constantly, my shoulder will sometimes twinge.
Yeah,
That makes sense.
Somebody asked me the other day about that.
It's the things you're not used to, or which cost an immensely amount of strength, which you actually don't have because you're not built for it. That really cause problems. And as for the nerve damage and skin hurting, joint hurting, I know all about that. You can just poke me and I'll say ouch. I'm just not aware of it. So Joe actually said, I wish mine was falling off the roof. So she was hurt pretty badly because this wasn't just from a fall. So yeah, different story. So if we just go, because I've got 7 criteria, which I wrote down, 7 things to consider. So we talked about being understood. Then does someone need to be an expert in a very, very, very specific field? So not just the ankle, not just the knee, not just nerve pain, but specifically right there, that hip, that joint. What do you think? I say yes nowadays.
Yeah, I mean, for me, you was kind of cutting in and out, so I don't think I fully caught your question.
Me either.
So I repeat it again.
Yeah.
So I said, do we believe that it's important that someone is an expert in his or her field? And I don't mean just joints or a knee joint, but the specific thing which is going on within the knee, or a specific thing with the nerves, and then the joint with that specific nerve.
I agree with that. I think that the more specialized that you get, the better treatment that you're going to get because their focus is more clear.
Yeah, I agree. I would only feel more comfortable if they were specific to the problem that I had.
Yeah.
Because if you go to a generalist, you're going to get general information. If you go to a specialist, you're going to get more niche down information, more quality information.
So that might be one of the most important things. Can listen to what you want and need. Well, we sort of talked about it already, like being on the same page. And I still think it's a funny story which you shared, Terry, about the one who didn't understand what you wanted because you didn't demand anything.
Yeah, it was a weird situation. I'm telling you, I almost like, well, you want to have a go? Are we going to go? Where are we going? You want to go?
I've never heard that before.
Yeah, it was freaking me out, man. I was like, what do you mean, what do I want? I was like, dude, he was throwing me for a loop. I was like, what do you mean, what do I want? Dude, I want you to do your job. Yeah. Like, that's what I ultimately said to him. I was like, I want you to do your job. So it was kind of one of those things. I was like, I don't know what you got to do. Dude, if I got to tell you what to do and how to do that, why are you the freaking doctor, dude?
Yeah, exactly, yeah.
And that's kind of how I felt. Like, I started to get excited, and I don't really get excited like too easily. But when I get hyped, dude, I'm a hype man. I can raise the roof.
Yeah, that's good.
His reaction to that was like, "Oh, you're gonna let me do my job? Holy crap!" Like, yeah, that's what you should do.
No, we had to close the door because it ended up it was a pretty deep conversation. We ended up closing the door on that one. We ended up like hashing that one out. But at the end of it, I got exactly what I wanted. So ultimately, I was just like, you know what? Okay, got you. I'm going to tell you what I want. You're going to give me what I want. And if we got to go to the point to where I'm telling you, I no longer want to come back to you.
I get it.
But I'll take what I want if you're going to give it to me.
Exactly. Yeah.
Yeah.
Yeah. I might, throw something in like, okay, so what's your response to this? And okay, and I'm not going to say I'm the expert here, but just, just some idea ahead. What can you do about it? Is it a good idea? Is it a bad idea? Why is it good? Why is it bad? And then there's discussion possible. That's nice. I like that. So, and one of the things I learned is, and it was back in I think that was about 30 years ago. So I had these inflammations of the wrists and the elbows and the fingers that caused a repetitive strain injury because of sitting behind the computer, not knowing what to do and all that stuff. And so one of the doctors actually said, okay, I've got all this information here. So what do you know about it? Do you know about it? Is it a little? And then she took the folder and she put it back down. And by that time, I wasn't, the person to say, oh, hang on, just give it to me so I can read it, But that's one of those things that, you need to learn when interacting with other people. So I guess communication skills come into play too.
Yeah, communication skills are very important.
Yeah. So then the next one, and that's an interesting one. We'll do the right and necessary tests. And that's what I've missed with a lot of people I went to see. They just assume things, but they don't do the tests which are required. Mm-hmm. Not until it's like 4 months down the road or 5 months down the road.
Mm-hmm. Yeah, that actually happened to me once. So I had, I had multiple tests done. It was like one test that came back that said, yeah, you have high cholesterol. And then another test that came, and then it was like, I want you to take these medication. So then I come back and it was like, dude, I've been taking the medication. I don't like the way that it feels. I'm no longer taking the medication. I want to get a second opinion. And then we take another test and it's like, oh, the results are this. You no longer need the medication. You're good to go. So it's like, well, which is it? Is it freaking, do I have high cholesterol? Do I not have high cholesterol? Do I need to change my diet? Do I need to take medication? Do I need to do this? Oh, well, we need to do more tests. I was like, dude, you know what? I'm done with you. But I'll see you later. It's like, because if you don't know and you're guessing and you're just saying do this and see what the results are, I mean, I guess I get it, but it's also one of those things that if you're not confident in how you're going to treat patients, then you don't need to be a doctor.
You can guess, but you at least still have to have some confidence in your decision making and your decision to have the tests.
Yeah. Well, like the old saying goes, man, when you assume, you make an ass out of you and me.
Yeah.
I didn't know that one. Okay, that's funny.
Yeah. You can keep that one for free. You can use that one anytime you want, Lexy.
Yeah, I'm not sure if that's the one to remember. Okay, but I like it. Okay, so the fifth one. Can come up with a different solution and explain why it's the right one for you and have you be okay with it. So basically, I already talked about that one. So like the one who did surgery on my ankle, the last one, she actually said, what you want, it's not a good idea because this, that, and the other. And then she suggested something differently. And I'm still grateful to her after all those years, because now I'm finally able to stand on 2 feet. And as for the same was the surgeon when it came to my doctor, he came totally with a totally different option, not just the braces, but also, the injections and not the anti-inflammatory injections, which the first one had given me, because he said, if you take those too much, that will also affect the quality of the cartilage. So, but one which is actually good for the joint fluid. So, whole different ball game. And that's what I like, people who come up with suggestions and, okay, try this, that, and the other. So, yeah. How about you? Are you open for suggestions?
You want to take it, Terry?
Yeah, sure. I mean, I'm always open for suggestions. I mean, it's one of those things to where I'll give you a scenario. When I was in the military, one of the blanket solutions was Motrin. No matter what it was drink water, take Motrin. go get more exercise and do more PT. It became a running joke. It was one of those things, like, it didn't really matter like what your injury was. Take Motrin, drink water, do more PT, come back next week and tell me how you feel. And it was one of those blanket answers that really ended up hurting a lot of people. And it's one of those things to where I eventually got to a point to where I stopped medicating. And I think that's truly powerful whenever you can take those things within your hand to where you fully understand what your body is and what you react, instead of taking, what it is that potentially could harm you. Because, let's say, for example, you take Motrin, for example. It's one of those things that what are the effects of that? And when you get medication, when you get therapy, when you get whatever the case may be, there could be effects that happen with that, and because of that, that could actually be more damaging to others. It's like, well, then you start outweighing, or you weigh the benefits of like certain things being wrong with you versus other things being wrong with you. It's like, well, this is going to cure this, but you know what? I'll never live the same again because, well, I'm going to have this problem now. So it's one of those things to where having the information and understanding what it's going to do to you and your body, you may want to make a different decision.
I have, because of my disability, I have chronic urinary tract infections. So the medicine that they give me, I've taken, I don't even know how many times, and I'm getting like, they've actually told me that I'm probably going to get so used to it that it won't work anymore. So I am worried about that.
Mm-hmm.
Yeah.
So I don't know. For me, I mean, that's one of those things to where there's two ways of looking at that. One, drink more water. Two, take cranberry juice or cranberry.
Yeah.
I mean, there's medication and different things, but it depends on if you're looking for a holistic approach to that, a doctor's approach. So look, here's the thing, and I really don't want to dive down this rabbit hole because then it starts getting political, and I really don't want to do that. It's one of those things that doctors are in business to make money. They're in business to either push certain medications because there's, maybe they're affiliates of that brand, or they have freaking stock in the market, or whatever the case may be. It's one of those things that's a whole different like political conversation I don't want to dive into, because I truly believe that there's a degree of that does happen. Otherwise, why would there be certain things that are just commonly prescribed? Maybe that doctor has stock in that crap. I don't know. And they're trying to make money off of, the more prescriptions they make, the more the stock goes up. I don't know. It could be an answer. But it's also one of those things to where nowadays we are discovering more and more solutions that were never possible before, but now they're possible because we're willing to dig and dive a little bit deeper into possibilities, opportunities, research, better data, better analytics is coming back, and people are now able to make choices. It's like, okay, here's choice A, B. It's like going behind choosing door number 1, door number 2, door number 3. Which door are you going to choose? Well, behind door number 1, we have a lifetime of like pain, and urinary tract infections or whatever the case may be. Behind door number 2, you are now the brand new owner of, whatever problem now you're going to have because of that. But guess what? You don't have the other problem. Now you got a new problem.
Yeah.
So kind of think about it that way. I know I'm kind of speaking a little sarcastically here, but that's kind of what it is. It's like throwing darts on a dartboard, throwing spaghetti on a wall to see what sticks. At the end of the you got them. It's going to continue paying money, continue coming back, continue having problems, and it just you're instead of getting to the root cause of like what actually is the thing, you're creating more problems.
Yeah.
Yeah, and that's why, for instance, pharmacies over here, they need to check if the different doctors don't subscribe all these medications which conflict with one another and stack on one another to take away one side effect, and then the next one. So what I like was the family doctor, the GP where I go to. She is not very keen on medication. So I have, like, for instance, extra vitamin D. I've got my allergy medication. But when it comes to high blood pressure, she says, well, it's within the margins. So it's okay. It's when I go to the hospital when they freak out because then it's literally really high because of the allergic reactions I've got. But normally it's a little bit higher than it should. But she's like, no, let's not do anything about it. the first time I went to a psychiatrist because of the ADHD I've got, they we experimented a little bit, and he said, well, we're not going for the highest dosage. If you want to go a little bit lower. And then at some point we said, okay, let's stop taking this altogether, because it literally froze my mind. But it did give me some answers, and that was a good thing.
I've had to take medicines where I've had to wean myself off because I didn't like it and I didn't like what it was doing to me. So I had to slowly get off of it.
Yeah,
Yeah.
medication can be very dangerous, especially when you can get hooked on it.
I can testify to that because I used to medicate for years. Whether I needed it or not, I just felt like I constantly just had to take, like if I had a twinge, like, ooh, is that a headache? I don't know. I'm going to take something. Ooh, there goes like, ooh, whatever ooh, I'm going to take something. And every single day I would take something 2, 3, 4 times a day for years until I eventually just got to the point where it's like, you know what? Enough is enough. I'm having headaches. I'm having migraines. I'm having aches and pains all over the place. And back in 2015, I was like, that's it. That's enough. I'm done with this. 2015, I started taking better care of myself. I started drinking more water. I started getting exercise. I started doing all these things. I stopped taking medication. In 2015, guess what? I lost 30 pounds. I got in better shape. I no longer have headaches. I still have aches and pains, like body aches and pains, because of the disabilities that I have. But you know what? I noticed something. By not medicating myself, a lot of the other crap that was going on within me went away. It disappeared.
Yeah.
Yeah, that's true. And as for Michael, what he said, when you need a certain extensive surgery, is always read about what are the side effects, what can happen, and all that stuff. And it's true, Terry, what you said about taking good care of yourself. So one of the things I figured out is when do I have a headache? When I'm not drinking enough water or whatever it is, and it's also when I've been working out or walking again. Then magnesium, that's one of those things. Vitamin D, because I've got A10, I've got black hair, and I live of all places in the Netherlands where people are blonde and blue-eyed, because we don't have any sunlight. So it's
Okay. I try to drink a gallon of water a day to flush it out.
Yeah, you got to. Water's important. If you're in a bad mood, drink cold water. If you're dehydrated, you got a headache, drink cold water. It's one of those things to where a lot of people don't understand that cold water has a lot more benefits and health benefits than people really do understand. For me, I drink about 6 to 8 bottles of water a day. I stopped drinking coffee like 3 months ago. I stopped drinking coffee. About 3 months ago, I stopped drinking coffee. Now I'm drinking this mushroom drink. It's like different mushrooms and turmeric and a bunch of other healthy organic type stuff mixed in there. And it took me a long time to really break free of drinking coffee, because I would wake up and I would drink like a pot of coffee, 6 cups. I would drink like 3 cups of coffee in the first 30 minutes of being awake.
Damn.
Yeah, and it was one of those things that I didn't think about it. I just truly didn't think about it. I was like, man, I am going to drink 3 cups of coffee, and by the time it was all said and done, before 10 o'clock, before lunch or whatever, I would have already had like 5 to 6 cups of coffee by then.
Damn. Wow.
Yep. Now I will drink a couple of these a day. One in the morning, which is certain types of mushrooms, and then at nighttime it's a different kind of mushrooms. So mushrooms have their medicinal benefits, their health benefits, and it's one of those things that it ties back into, once you start making different decisions and you start paying attention to like how your body reacts, how your mind reacts, how things react to that, you will truly understand that there are some holistic things that are out there that are doing really good things for people, but you'll never know until you try.
Yeah, and that's one thing that is probably the most important thing of the whole topic, on which I keep saying on and on and on, is know your body. know what it feels like, know when something is off, and that's what you want to get across to the other person. Like, this is not normal for me. When I do this, that, or the other, this is the reaction, and normally I don't have it. That's what they can work with, because they don't know the normal you. And you need to know the normal you, and especially you, Michael. You are, of course, in a very different situation. Then again, so has Terry because of all the injuries. So do I because of the EDS. So
you have to just yourself and be aware.
Yeah.
Yeah.
Like right now,
Got
I'm
it.
in a lot of pain. Just standing here, I'm like, you see me kind of bobbing back and forth because
Yeah.
I'm like my back and my buttock area and back of my legs are just in so much pain right now. Like I'm doing like hip rotations. I'm weaving back because my hip hurts. It's time for me to wind down. And, you know, Lexy, you and I, we've had this kind of conversation where I don't like to do things at night because it gets me kind of wound up. I start experiencing more pain, you know, especially that's the reason why it's important for me to know what that routine is. So that way I calm down, I cool down, I relax. I'm doing, like I'm having my tea, I'll read. And then when I lay down in bed, because if I don't, guess what happens? When I'm laying down in bed, I'll have like restless body syndrome. Everything wants to move, everything wants to itch, everything wants to do all these different things. And it's like, man, I just can't get comfortable.
Yeah, that's not good.
Mm-hmm.
So if you want to go right now, just go. Otherwise, it's probably going to be like another 5 minutes.
I'll hang out with you guys. Man, you guys are cool, man. That's why I'm hanging out with you. No,
Well,
I'm just
it's a
playing
good thing
around.
you show people that we need to know what we need to do.
Yeah, I
And
mean,
I
you don't
think
know what
Michael's getting tired too a little bit.
you don't know what you don't know until you start having those tough discussions. And Lexi, you and I, we've had those tough discussions, and it's one of those things to where getting information out there, getting knowledge out there, getting experience out there, because we all have experienced different things. And once again, it gives people those thoughts, those ideas like, ooh, I feel that way. Ooh, I've experienced that. Ooh, I never thought of asking the doctor for that. And I truly believe that having these discussions like this right here, the way that we are in this format, sharing, you know, those things, it really allows other people to think, okay, I do have a choice. I do have options. I
Yeah,
do
they
have
do.
some things that I can bring to people. But if you're not willing to have that discussion and you stay enclosed in, you'll never fully discover what those opportunities are, what those possibilities are, what potentially is wrong with you, or is it just up there within your head? I don't know.
Yeah. A
Yeah.
lot of people, they either go for the quickest option or the one who's closest by
Mm-hmm.
or only the one they've been told to go to.
Yeah.
That's basically the three options they choose. And I don't mind driving a little bit further. I don't mind waiting a little bit longer as long as I know that I'll be taken good care of.
Yeah.
So,
Mm-hmm.
I've
okay,
had
so let's
about
go to
20,
number
the
6.
year.
Sorry, Michael, what did you want to say?
I've had the same doctor for 20 years, and I've had the same urologist for almost 20 years. So, but I get what you're saying. You need to examine people more, talk to people more, ask questions, and see what they are about, so that they can more help you out more.
Yeah, but if you know that and you go to someone for 20 years, that person should know you by now.
Oh yeah, I'm talking about like new people.
Yeah,
Yeah, yeah.
yeah, I agree. And then they need to know and to get to understand you.
Yeah.
So the sort of last thing I have here is the doctor is willing to go for the less popular option because that's the best one for you. So it might not be one they do quite often. It might be the exception. It might even be a new one. It might be an experimental one where they cannot promise you it will change, but it's probably the best one still.
Mm-hmm.
I think it depends on the person. I mean, because doctors are different. There's better doctors, there's worse doctors. Some, like Terry said, want to give you a medicine that will benefit them. Some will actually give you a medicine that will benefit you. So it just depends on the certain situation.
Yeah, that's
Yeah.
that's that's true. And I
There's a
always have.
There's a lot to unpack
Go
with
on,
that
Terry.
question right there. There truly is a lot to unpack with that because, the thing is that if I don't know, there's different opinions and different perspectives. I think that there's a degree of if doctors were really trying to cure things instead of mask it, I truly believe that we wouldn't really have much of a need for medication. But that's a different conversation. That's a different conversation. And
Money and problems, not cures.
yeah. Yeah, and that's what I found out for me. That's what I was doing for years is I was masking things and I was causing further damage as opposed to ridding my body of the things that was actually hurting it more than it was helping it. And when I got rid of that, I started noticing a difference.
Yeah, I get that.
Mm-hmm.
Yeah.
Perspective.
I had to experimental surgeries because they just didn't, they weren't out there normally because it was so rare what I had that it was like, okay, yeah, we need to do this, but we've never done this. That's why all those doctors, especially when it came to my ankle, were so reluctant to do anything at all. So,
I think,
but
I
it
think
is going to work even if they can't promise it.
well, I think it's a matter of
You wanted to
perspective,
say,
willing to do.
yeah. Well, when she told me, like, I cannot promise you that the pain will be gone, and nor can I promise you that you can walk because it's been like 5 years already. And yes, it has taken me over 3 years, and even today I walked a little bit further than I normally do. And then it was at some point I was like, oh yeah, my ankle hurts again. And because of the new problem I got to experience with my knee, I sort of forgot about the ankle. I was like, oh, it's okay again. But it's still, and now I walk a little bit more. I'm noticing, okay, yeah, I still need to learn. It's like a long-term process of learning to walk again for the third time in my life.
Yeah.
Mm-hmm.
Yeah, and that's okay, by the way. I don't mind. So number 7 is basically checking all the options above, which we talked about. So if you go somewhere and it's the first time you go somewhere, then please write it all down, read a little bit about it, get informed, be open, and feel like it's trustworthy. There has to be this connection between you and the other person. And if you feel like you're not listened to, or it's not trustworthy, or what did you say again, Terry? It was water with whatever for the same person.
Yeah, so I mean, for me, it comes down to feeling. I don't really. I mean, for me personally, I don't really care what doctor I go see. It could be anybody. I really don't care. That's just my personal preference. At the end of the day, it really boils down to exactly what you're saying. The patient wants to be heard, understood, and felt like they matter. And I think that when doctors take that approach to make being personal with the personnel, so to speak, is the concept I'm after with this. And when you are kind of you put that personal touch on that, when you're able to listen, you're able to understand, not necessarily from a standpoint of, man, like I remember walking into a place and it's like they didn't do any tests, they didn't do this, they didn't do that, and they already had a diagnosis before even doing anything. I'm like, dude, you didn't even look at anything. You didn't check, you didn't ask questions, but you already knew what was wrong with me. How the hell do you know what's wrong with me? You didn't even check anything, kind of a thing. So I think that it really kind of comes down to I really think that it comes down to listening to understand and then understanding so that a way you can provide the best possible care. And I truly believe that there's opportunity for improvement in all of that.
I think
Yeah.
one important thing is you need to vibe well with whatever doctor you have.
Mm-hmm.
Yes,
I agree with
that's
that.
absolutely true. And that's why I'm not. Normally I wouldn't be that fond of ratings, but nowadays I've learned to look at it. But more, moreover, I look at the story behind it. So who's this doctor? What are their experiences? What are they good at? What are people saying about him or her? Are there references, especially the references? that could make all the difference. But I believe that for the people who don't go to doctors that much or who are not used to communicating, it's so important to be able to express what it is they feel. But when they're not used to talking, they're probably also not used to talking about what they feel, and maybe they don't even know, and that's kind of a challenge.
Yeah.
So
I agree.
100%. All right. Hey, awesome.
yeah.
Lexy, Michael, I do have to go. It's after 9 o'clock here. Kids, we're getting ready to put kids in bed and everything. They got school tomorrow. So great conversation. I truly enjoy talking with both of you. Interesting conversations. And I think, this was kind of, Lexy, you know me, I love to talk about positive stuff. I love to talk about motivational stuff, books, entrepreneur stuff, business stuff. But to be able to step out of that into a conversation like this, I just want to say thank you very much. It was a truly refreshing conversation.
Well, you're so very welcome. And I think we're about to wrap up, Michael, right?
Yes, we are.
So I guess it all comes down to communication, knowing what you want, and you can at least tell what you need. That doesn't mean that you're going to tell the doctor what he or she is going to do, but you can tell what you want to get out of it. And this is about knowing yourself and being able to express this. And if you do so, then you probably won't be brushed off. And if they do, please find a second opinion or a third opinion.
Matter of just knowing, speaking up. Okay.
Yeah, exactly. It's about speaking up and speaking out if you don't agree.